let's move into vitamin D and cross the fourth supplement off our list here. And obviously, we can get vitamin D from getting proper sunshine. How do we, with that variable, obviously, getting things in the natural form, like through the sun or through food, is preferable, and at least in our world. How does somebody know? Obviously, we can get tested and see what our vitamin D level is, but in a general sense, how does somebody know how to balance that out with getting sunshine when they can, taking a supplement, and then coming back to what we talked about before, the RDA versus an optimal dose of vitamin D to thrive?
A lot to unpack, right? So, several things to know. So, vitamin D is activated by exposure of the skin, of course, to sunlight. Well, a lot of us live at a latitude that the sun is too weak much of the year. You're like me; you work indoors, so it's bright and sunny where I am in suburban Chicago. But I'm not getting any vitamin D. And then when we go outside, you're a law-abiding citizen. You wear clothes, so a lot of your surface area is covered. And we start to lose the capacity to activate vitamin D in the skin typically after age 40. You start to really, so this used to happen in my practice, for instance. These snowbirds, this is when I was living in Milwaukee, Wisconsin, people would come back and I'd say, let's check your vitamin D. They said, no, doc, no, no, look at me. And they show me their dark brown tan, right? And we check their vitamin D, it'd be 15, severe deficiency. So, and these are people in their 70s typically. And so, a lot of things to factor in. Uh, Ideally, you and I would spend our days outside in a speedo bathing suit and get lots of vitamin D. By the way, kids who do that in a tropical climate, let's say you're a lifeguard in Honolulu, you would have a 25 hydroxy vitamin D, that's the blood test, of about 89, 85, 91, around there. Now, that's naturally obtained and physiologic. So that gives us a little bit of guidance at what is safe and what's not safe. So no one has problems from vitamin D being a lifeguard in Honolulu. But what other guidance do we have on what constitutes a healthy level of vitamin D? Well, one of the good things to be aware of is when you have lack of calcium in your bloodstream. Calcium is very critical. If you have low calcium, you can have seizures and die, have heart rhythm disorder and die. So the body maintains blood calcium very tightly in a very tight range. Well, it does so by the parathyroid gland. Parathyroid next to the thyroid, little four of them right here, and it produces a hormone called parathyroid hormone or PTH. So when blood calcium goes down a little bit, your parathyroid release more PTH to extract calcium from your bones, which is not good because if you do that too often, you get bone thinning and fractures. So, at what level of 25 hydroxy vitamin D is PTH maximally suppressed? About 55 nanograms per milliliter, telling us that it's that range where you have maximum bone health preservation. Another perspective, if we took thousands and thousands of people and measured their 25 hydroxy vitamin D level and then watched them have cancer or not have cancer, at what level does the incidence, this is observational, so it's not real solid, but um, at what level of 25 hydroxy vitamin D does risk for cancer plummet? Ovarian, uterine, prostate, breast, 50 nanograms per milliliter. What does the lab say is the reference range that your doctor interprets as the normal range? Typically 10 to 30. Why do they say that? It used to be 10 to 20, by the way. Well, here's what they do. They take a random population and they measure their 25 hydroxy vitamin D. We now know that the majority of people are deficient. So they take a population deficient and define normal from this deficient population. The easiest analogy is a story I often tell. So Jesse says to me, hey, what's the average weight of a woman in Chicago? So I say, well, I'm not sure. Let's get a scale and let's go to the nearest mall. And every woman walks by, we say, ma'am, could we weigh you? And we weigh 1,000 women, right? 1,000 people later, we tally it up and I say, okay, Jesse, look at this. The average woman weighs 176 pounds, plus or minus 25 pounds, 2 standard deviations. Should we interpret that as normal or ideal? Of course not. So if we measure weight in an obese or overweight population, we're going to get this weird skewed number. That's what they did with vitamin D. So, and this is true, by the way, for not all, but many laboratory values. They're quoting values obtained, reference ranges obtained from a diseased population. And so we don't pay attention to what the lab says about reference range. So what I've been doing is aiming for around 60 to 70 nanograms per milliliter. I've never seen any evidence of toxicity doing that.
If you enjoyed that clip, you're going to want to head over here and catch the full episode. I'll see you over there.
No, there's nothing else that tracks with LDL cholesterol because it's not a real number. It's a fictitious number. It's obtained by something called the Friedewald calculation. The LDL cholesterol reducing franchise, statin drugs, PCSK9 drugs, all that stuff pay huge